Hi, my name is Behnaz Sarrami. I'm the pharmacist and medical science liaison for IDgenetix. I wanted to walk you through our IDgenetix sample review report. So when you're looking at it, you can seamlessly go through it. So the layout is on the left-hand side underneath the green column. You see all these medications that either don't have a drug-gene interaction or a drug-drug interaction. And on the right-hand side underneath the light orange column, you'll see all the medications that either have a drug-gene interaction followed by a drug-drug interaction, meaning that drug-gene interaction will come ahead of drug-drug interaction. And you will see, let's take Jane Doe who's on citalopram, and the reason it's dark or black is just this patient is actually on citalopram, versus when it's white areas, this means if you were to select any of these medications, it gives you some caution to look into. So it gives you a comprehensive report on the dosing guideline, for example, for citalopram. This patient is a 2C19 metabolizer. They'll let you know to adjust the dose or use an alternative medication that does not use 2C19. Or if there's clinical indication for your patient to be on citalopram, start off with a 50% lower dose and then titrate up. It tells you it's from CPIC guidelines, and it gives you a reference as well for the PubMed ID reference. And it does give you the black box warning, a warning on a medication, for example, particularly for this one, since they're 2C19 poor metabolizer, to stay within a maximum of 20 milligrams a day because of QT prolongation. And so it also gives you, we provide the drug-drug interaction piece right here. And so again, drug-gene interaction comes first ahead of drug-drug interaction, meaning since this patient is on citalopram, if you were to take this patient off of citalopram, there is no drug-gene interaction with these medications. Otherwise, it will show up here first. So since they do not, all these medication will go right on the left column underneath the green, and those are the possibilities to use for the patient. So it doesn't give you, as it does over here, a detailed explanation of what the interaction is or what to do with that interaction between the two medications, because as you know, there's clinical indication why a patient can be on two medications that do have a drug-drug interaction. So we let you decide what that looks like based on your clinical judgment for your patient. And also, if you see there's little number ones on some of these medications, that just means that medications are on Beers criteria. Basically, all list of inappropriate medications for patients age over 65, either because due to anticholinergic effects or risk for falls. And so it does give you a detailed explanation on that piece and kind of lets you again decide what that looks like for the patient. And here's our gene panel. We do have the pharmacokinetics genes, which are all the CYP enzymes, and we have pharmacodynamics genes. And if you're not familiar with all the genotype and phenotype, if you look on the very last column, if it says clinically significant, it will show up on your actual full report. But I'll just very briefly walk through every one of these genes. So the ABCB1 is more for the absorption of medications. ADRA2A is for the methylphenidate metabolism. COMT, people have thought about it as personality gene, and the HTR2A does for the if the patient is more prone to the side effect profile of an SSRI. HTR2C are more for the metabolic interactions of antipsychotics, such as weight gain or increased glucose levels. MTHFR is for the enzyme that converts the folic acid to folate, so it has to do with that cycle. NAT2 is for metabolism for some pain medications such as sulfasalazine. OPRM is for pain, and then SLC6A4 will be for the transporter for serotonin. Again, here on the summary comments section for the MTHFR specifically, it shows you detail as to if the patient has a combination genetic variant, what that will look like based on their enzyme activity. If it's normal, low, it will give you detail like here. Again, we have the Beers criteria information with the link to the website. And also we have the hashtag sign or the number sign on some of the medications. That means there are CYP activated prodrugs. Basically, not every medication is activated, such as, let's say, tramadol and codeine. So if you see that symbol on a medication, that means that medication is inactive and it's using a CYP enzyme to activate. So if the patient, for example, is a 2D6 poor metabolizer, then you will see that on coding in tramadol and let you know that that's caution to be looked into. So it gives you a comprehensive report and lets you decide what that looks like for the patient. So if you have any questions on any of these genes specifically or want to go over the patient's actual report, reach out to me. I'm the medical science liaison. We'll walk through them and explain the genes, and I'll be happy to do that.